Welcome to HPV World, a human papillomavirus professional education project related to the educational program of the Catalan Institute of Oncology. The World Health Organization called for a massive campaign to eliminate cervical cancer as a public health problem in the world within the century. Cervical cancer is the dominant cancer induced by HPV, though not the only one. The strategy, defined by the WHO, includes the recommendation that 90% of girls receive HPV vaccination by the age of 15 and 70% of women receive HPV screening at the ages of 35 and 45. And in 90% of cases, both for pre-neoplastic and neoplastic incident cases, patients should have access to adequate treatment, including palliative care. It is clear that, to achieve such a high level of participation of the community into an intervention program, it is necessary to create a state of opinion favorable to the proposal at all levels. Globally, society has indeed approved and accepted this proposal, and over 50% of countries in the world already introduced HPV vaccination into their routine immunization programs, and are slowly transitioning from cytology-based screening programs to HPV-based screening programs. But by far the strongest determinant of what individuals will end up doing is the advice and the recommendation of their healthcare provider. HPV World specifically targets the professional education of the healthcare provider, with the hope that this knowledge will be transferred to the general population in the best possible way. HPW influence in 2022. On this map, you see that North America and Europe are the areas in which HPV World has most of its influence. Plans are now developing to specifically address issues and needs in other parts of the world. Overall, close to 100,000 readers consult our files. The potential for expansion in 2023 and beyond can be defined over 3 lines of intervention: to interact and to support local elimination campaigns by publishing materials on the countries that have decided to introduce both HPV screening and HPV vaccination. Translations of the bulk of the library, because it is clear that, as you move away from the core HPV professionals, the working language continues to be a barrier, and it's now feasible and easy to accomplish to generate vernacular versions that can be used locally. Editing podcasts, facilitating access to the materials, both as an audio or as a video resource. Acknowledgements. There are a number of institutions that have endorsed the quality of the project, including the International Papillomavirus Society, IPVS, the HPV Prevention and Control Board, the HPV Information Centre, the educational programme e-Oncologia, the European School of Oncology, Eurogin, EOGIN, ESGO, UICC, and the Pediatric Association in Spain. Specific thanks to the many HPV stakeholders that provided unrestricted educational grants to support the project and keep it going for over 20 years. In conclusion, in spite of the value of HPV vaccines, only 15% of girls and 4% of boys in the world are currently HPV vaccinated. In spite of progress in HPV-based screening technology, 2 out of 3 women in the world have never benefited from a screening event. Would you like to collaborate? Subscribe to the newsletter, share HPW with your colleagues, and contribute to HPW. HPW is one more push in this direction. Thank you very much for your interest and for supporting us, should you wish to do so.